The movie was impressive on many levels. First off, Matthew McConaughey, I mean, he nailed what it is like to be a patient and what they struggled with, and as did the other actors and actresses in the movie. I think there was a certain type of desperation that they captured completely, and I thought that was extremely well done. The notion of buyers clubs were clearly there because of the desperation. People were dying, and the way that I could explain it at the time when I gave talks on AIDS, when I walked to, especially to medical students, and said, everyone, right now I'd like you to think of your 5 closest friends growing up, and 4 of them have died in the last 2 years. How do you feel? How does that make you feel? And it's scary, and it's lonely, and it's infuriating, because you look around and you don't see anything being done, and you hear rules from the FDA and from other places in the government, slow response, no response. And that anger, that infuriated anger, is what was portrayed in the movie, I think, pretty well. The rules of the FDA were there for a good reason. It goes back to the, 1814 Snake Oil Act, when they wanted to protect the public against harmful substances, from quackery, from false claims. And they put these rules in place, and those rules ultimately accumulated, like most laws do over time, such that those rules build up without anybody pulling back and saying, is there a harmful effect of these rules that we didn't anticipate? The buyers clubs brought that out in full relief, such that they said, why are you not allowing us to gain access to these medicines? FDA response, because they could hurt you. And they look, but I'm dying of this disease. How much worse can it be? And ultimately that got to parallel track and fast approval of drugs. But for the people going through it, like the Dallas Buyers Club people, it was a real phenomena that was quite difficult to stomach. Now for the downside. As good as the movie was at portraying the affect and the environment and the anger and the infuriation, there were several inaccuracies that were kind of tough for me to watch. First off, the peptide T that he was taking, that the movie implies kept him alive for an additional 6 years, is basically an inert substance. It doesn't do anything. And so he must have been doing something else that kept him alive, because in general, peptide T, while it worked sort of okay in the test tube, never worked in a human trial, ever, had no activity. So that was a little tough to swallow. But the biggest thing I had trouble with is the buyers clubs I was familiar with, especially the one in Atlanta that was superb. Tom Blunt, Dawn Averett, Jim Straley, a number of people who ran that. I knew them well. It was not for profit. And the thing that really irked me is that this guy was doing this to line his pockets. And I'm not saying he wasn't doing a good thing for other people, but the best buyers clubs at the time was like a commune. It was a co-op. And they worked together to gain access for everyone. And they tried to get it to as many people as they could. And if they were generating revenue, they plowed it right back into getting more drug. And that's the way the best buyers clubs operated. What the buyers clubs did more than anything, besides getting drugs to people, was it helped the community organize. And it put them in the same room together so that all their energy, their anger, their frustration could then be turned into a positive direction. And in particular, a story that I tell in a book that I'm about to publish is one of Tom Blunt. And Tom's partner, Jim Straley, Jim was dying of AIDS, and Merck was developing a drug called Indinavir at the time. It's now on the market. But this is in 93, 94. And Tom knew the power of that drug, and he wanted to get it for Jim, and Merck wouldn't release it because they had too much, they couldn't make enough of it for their clinical trials. And so Tom flew up to Merck to sort of implore them to give Jim the drug. And the story, as I tell it in the book from Tom, basically describes him walking in the door and saying that in the time that they've been talking, the number of people who have just died from AIDS is the same number of people who would die on a 747 that would crash over Lockerbie. And the reason that was important is, unfortunately, one of the Merck scientists who was involved in the development of one of their key drugs died in that plane accident, and that really got their attention. And to me, that turned the tide to create early access programs. So yes, buyers clubs, organized community had tremendous impact on gaining access to drugs. At the end of the day, I think the movie did a service because it pointed out a very powerful time in our history where there was a disease that was ravishing people, destroying communities, and how those communities responded to come together and point out the deficiencies of our current system and make it better. And what I'm trying to do in the book that I just wrote is show how we can take lessons from the experience of a bad disease, how we came together to create a solution, take our healthcare system, which ain't working too well right now, pull it together and have a better system at the end of the day by working together as one community, all pulling in the same direction. I think we can do it.